How do lymphoma patients manage fever? Fever can be a significant concern for lymphoma patients, especially those with non-Hodgkin lymphoma. It can arise from the lymphoma itself or as a side effect of treatments. Understanding how to manage fever is crucial for these patients to prevent complications and maintain health. Fever may be part of what are known as B symptoms. These symptoms also include night sweats and unexplained weight loss, indicating that the disease is active in the body. Additionally, fever can signal an infection, which is particularly important for lymphoma patients. Treatments like chemotherapy can weaken the immune system, making infections more likely. To manage fever effectively, patients should regularly monitor their temperature. If it rises above 38 degrees Celsius or 100.4 degrees Fahrenheit, they should report this to their healthcare provider without delay. This is vital because a fever can indicate a serious infection that may require immediate medical attention. When a patient experiences fever, healthcare providers typically conduct a thorough evaluation. This may include clinical assessments and laboratory tests to identify the cause of the fever. Tests could involve blood cultures, complete blood counts, and imaging studies. These help differentiate between an infection, lymphoma progression, or inflammation caused by treatment. Preventing infections is a key part of managing fever in lymphoma patients. Since treatments like chemotherapy can suppress the immune system, patients are at a higher risk for infections. Some preventive measures include taking prophylactic antibiotics or antifungals when recommended, practicing good hygiene, and avoiding exposure to sick individuals. Vaccinations are also important, but live vaccines should be avoided during periods of immunosuppression. If an infection is suspected, treatment usually begins promptly with antibiotics or antivirals, often based on the most likely pathogens. Symptomatic treatment for fever can include antipyretics like acetaminophen or nonsteroidal anti-inflammatory drugs, unless there are contraindications. While these medications can help reduce fever and improve comfort, they do not replace the need for medical evaluation. Patients should seek emergency care if their fever is accompanied by other concerning symptoms such as chills, persistent vomiting, difficulty breathing, confusion, or signs of sepsis. A fever occurring with low white blood cell counts, known as neutropenia, is particularly serious and requires hospitalization and intravenous antibiotics. Healthcare providers, including oncologists and hematologists, play a crucial role in managing fever. They help balance the need for infection control with ongoing lymphoma treatment. Sometimes, adjustments to chemotherapy schedules may be necessary if fever is related to treatment toxicity. In summary, lymphoma patients manage fever through careful monitoring, prompt medical evaluation, preventive strategies against infections, symptomatic treatment, and knowing when to seek emergency care. This comprehensive approach aligns with established medical guidelines and emphasizes the importance of individualized care and patient safety.